Hi, my name is Lynn and I'm studying to become a B.C.B.A. In today's topic, we're just going to discuss what I do. So I said in a previous video, I am an R.B.T, which stands for Registered Behavioral Technician. So what is that exactly? Well, I am certified via the B.C.B.A, which is the Behavior Analysis Certification Board, to work and implement through applied behavioral analysis theories and practices. So basically what that means is I am legally allowed to work directly one-on-one with kids, and I have undergone a 40-hour training and additional screening through, like, I've been tested on what certain things mean, what I have to do ethically. So they cover a wide variety of topics within the world of ABA. So they cover ethics. So as an RBT, I am not allowed to babysit any of my clients. That's a huge no-no. That's called a dual relationship. As an RBT, I am instructed to apply different types of methodologies. So DTT versus NET, which is discrete trial training versus naturalistic something I can't remember at the moment. But basically what it means is it therapist-led, which is me, or is it child-led, which is client-led, right? For instance, a typical day for an RBT would be if you go to a client, you start off your notes, you set up what's called antecedent procedures. So you go through the house or whatever room that you're with the client for most of the session, and you set up the room for success. If you see something distracting, you put it away. If you know that you're going to work on shapes and colors, you bring out the shapes and colors. So that's what the first 15 minutes of your day should look like for that client, for that session. And then next, you greet the kid, you kind of pair with them a little bit, which means you are reestablishing your relationship with them of, hey, I'm a fun person. You want to actually work with me. I always say play with me, right? You want to make it fun. You want to make their interests your interests. So like, let's say a kid has a Buzz Lightyear toy. You're like, oh yeah, that's really cool. Come on, share it with me. Let's see what you got. It's like, oh, you don't want to share it? Okay, well, I'm going to go get a Woody, and I have Woody, and you play Buzz Lightyear, and kind of just establish a sense of, okay, we're going to play now, we're going to do something. The only time this would be different is if you are specifically instructed to only do DTT, discrete trial training, as I explained, and it's very dry, it is very therapist-led, and it is very much a, here, we're going to sit down at the table, and it's pretty much going to be very academic feeling. So you run discrete trials, you have a very clear presentation of an SD, which is a discriminative stimulus. I know the letters are flipped, but that's just how they describe it. And you are expecting a response, or at least a single instance of behavior. So if you present the color red, you want that kid to say red, or point to it, or whatever you're expecting, whatever has been explicitly told to you by your supervisors. This is the goal we're working on. This is the SD that you present. This is the expected response. And then they either receive a consequence of receiving reinforcement, like, yeah, good job, a lot of praise, or they get a piece of candy or something. All these things are pre-established before you really jump in. And so that's like the DTT side. Those tend to be very boring, very dry. Some ABA companies have gotten a really bad rap because that's like all they do. I've never met a child that did this, but I have been told of clients who will answer a question and immediately put their hand out expecting a reward, which is not very naturalistic, right? So there's a lot of different things an RBT can do. What I prefer to do, and what most of us are really instructed to do, is the NET, which is naturalistic environment training. Haha, there you go. Which is basically like the kid has Buzz Lightyear and he's flying around and he's like, yeah, this is so fun. And then he puts it down for a second and you're like, oh, cool. And you kind of like pick it up and you're like, yeah, this is awesome. And he comes to you and he kind of like signifies he wants the toy, but he's not quite saying the words, even though in this understanding he can use his words. So you could say, you can kind of hold it back and kind of have this like expecting like, what's going on? And the kid will say like, oh, I want toy. And that is the expected response. So the antecedent is someone has it, the item of desire. The expected response is the kid will say it, and it's in a very naturalistic setting, right? I'm not demanding that he says anything. I'm not presenting a very distinct, like, okay, here, here's a picture of Buzz Lightyear. Like, you have to touch it or you have to like say it before I'll give it to you. It's very much no, he's wanted to play with it. Everything is run through his motivation and he's interested in it. And then he says, I want Buzz Lightyear or I want toy, and then I give it to him. So that's his consequences. He receives it. Very distinct differences between DTT and NET. And every RBT is going to participate in both of them usually, hopefully one more than the other. Beyond that, an RBT's job is also to instill any sort of parental training if they are instructed to do so with that case. So every case is customized and unique to that individual that the case is surrounding, right? So you have your supervisors, you have your managers, and the RBTs, of course, and then you have your stakeholders, which are the parents or the people involved in the life of that client. And then, of course, you have the client. So there's a lot of collaboration involved with every case, right? And there's a lot of training involved because when you are pairing with a kid, you're going to see different competencies and you can put that in your notes like, oh, you know, like we're running field of 3, but he showed me he could do field of 5 because on accident I had 5 items out and he immediately chose the correct one. It's a very communicative job. Like, you are constantly saying, okay, I did this with the kid, this is what we ran, and this is what we're doing. What you don't do, though, is you don't implement your own training, like for the kid. You don't implement your own programs. Those are all for your supervisors and managers to give you. Once they provide it to you and explain to you how to run it, that's how you run it until they say, like, okay, it meets a mastery criteria, which, once again, every program is different for every kid. Master criteria can be they get it correct 3 times in a row for 3 sessions. One could be they get it correct for a full month. Another thing RBTs do is we have to maintain our supervision or our certification via supervision. So 5% of our working hours must be supervised. So I have to make sure that I have supervision hours along with all of my distinct working hours. I am constantly setting up meetings with managers. I'm constantly checking in with managers to see when they're going to come see me while I'm out in the field doing my field work. And so there's a huge ordeal with what I'm capable of doing while working. I need to make sure I maintain that supervision to maintain my certification. The last thing that an RBT really does per se is every year you need to recertify essentially, but they don't take it away or anything. They just want to say like, hey, are you still working as an RBT? Yes. Have you been tracking your hours? Yes. Can you pass this assessment? So they always have a yearly assessment. Realistically, you should be getting assessments pretty regularly, but that's just for your job's sake kind of deal. They should be doing like monthly integrity checks. But for your assessment, it has to be done no earlier than, I think it was 60 days before your RBT certification is due. And you have to have an assessment done by a B.C.B.A. So they overlap you, or they'll have a meeting with you. They go through they go through a checklist of expected competencies. Can you run DTT? Can you run NET? What is a reinforcer? Things like that. So they go over what you're expected to know. And then in some cases, you need to show what you know. So like, can you implement this? Can you implement that? You can also just describe them depending on what it is, right? In the checklist. That's really the last component of what an RBT does. So just covering the basics, you work with kids. I work specifically with kids who are diagnosed on the spectrum of autism. And when I say kids, I mean I work from people of 2.5 years of age to, I've worked with a 19-year-old before, so whole range in between. You make sure that you are maintaining supervision hours. So that's a big difference between you and just a regular BT or regular behavioral therapist, is you actually have to maintain hours and you have to be assessed yearly. Those are really important elements to being an RBT. As long as you're in the world of ABA, you should always be doing these. And that's pretty much it as far as I recall. So I will see you in the next video when I pop that up.